Today I'm going to be talking about how I became a nurse. Hey, thank God that I finally got here and I'm able to tell the story because what a journey it has been. I'm gonna start with how I got into healthcare in the first place. So, a month to my 18th birthday, I enrolled in a home health aide certification program. I wanted to do this because obviously at the time I was working at McDonald's. It was my first year in college. Now I was working overnight shift so I could be able to make it to my morning class that started at 7 a.m. on the dot. Imagine how strenuous that was. So I definitely knew that I needed a job that could enable me to work and earn a living as well as be able to study and perform well at my studies because the overnight shift was really affecting me at some point. I became very drowsy in class and all of that. You know how the drill goes. And at that time, I don't think it was really sustainable for me because they were paying about what, $9 an hour, and hey, that was like an increase from what we had before. So yeah, and the rent that I had to pay wasn't much different from what you would pay now for one room, right? I mean, our rent then was about $500 a month, so imagine earning just $9 per hour. So I knew that hey, I needed to do something different. So I registered for this course. I didn't waste time. And by the time I turned 18, my certification was in my hand and I was ready to work. So, with this job, what I did was I worked in different clients' homes, mostly geriatric patients, like patients that are both like 60 and so. And I also work with children that were disabled for one organization. Well, not organization per se, company. I work with a variety of different people. So with this job, I assisted them in the activities of daily living. I was exposed to different health conditions, especially diabetes. I was able to see patients who had hypertension, a variety of different illnesses that they dealt with. So I did this for about 6 years, and this job really supported me at the time, and it also helped me while I was going to school because I was able to meet incredible great clients that were permissive and allowed me to study. So it was very flexible. I could choose to work what time I wanted and things like that. So after working this job for 6 years, right, I transitioned into the role of a clinical nurse extern. So in Maryland, where I'm based, there are several hospitals that offer this, and you can apply to work at the hospitals during the summer or for the winter session. So I had applied for the summer session, and I got to work alongside a nurse. So she was my preceptor for about 3 months because it usually lasts for that long, except during the winter, which is much shorter. So I worked alongside the nurse. I saw what she was doing. She taught me how to draw out the medications from the pixes, how to administer different intravenous drugs, how to administer medication to the patient, how to assess her role the first thing she came in the morning. And the good thing about my CNE program is that we're allowed to float to different units. So I got to preceptor with different nurses, and it really exposed me to a lot. I learned a lot during this preceptorship program, and I'll encourage anyone who is actually a nursing student out there to look for an opportunity where you are to partake in something like this. It was quite an eye-opener, for what I was going to be doing later on when I finished school. So after that, I transitioned into the role of a PCT, which is a patient care technician. In some hospitals, they say like a nursing assistant, CNA, but at this facility, this is what it's called. And it might be for different reasons too, okay? Because depending on what facility you are, you know, depending on them, they tell you what tasks you're allowed to perform. Like at my units, we were allowed to draw blood, we were allowed to check the patient's sugar, do a finger stick. We were also allowed to insert a Foley catheter, as opposed to even the other branch or the other campus. Some of these CNEs or the PCTs, they are not allowed to do those things. So I appreciated the fact that they were very broad in what they allowed us to do, which allowed me to learn a lot. Like by the time I became a nurse, I wasn't scared to do finger sticks, to insert an IV, things like that, which that might be a challenge to like a new nurse and things like that, or even putting up fluids. I was already exposed to it, so everything was just kind of like a refresher when I started doing my orientation as an actual nurse. So I moved away from that PCT role, and I did all of this while in school. I also joined the student nursing organization at my school. I was very active there. I joined a leadership position. I became the president of my association. I participated in Suri research program, where I was able to do a research, and that enabled me to present my work at the Maryland Nursing Student Association as well as the National Student Association. And for the first time, my school was recognized nationally, and they were able to allow their students to present their work at these conferences, which was an amazing opportunity where you get to meet great people in your field, and you get to meet those that have advanced in their career and ask them questions. And so I would say that during school time, I did put myself in a position to gain a lot of exposure, and it did help my mindset a lot, to where I am in the position that I am right now. So fast forward, I finished nursing school, I graduated. I didn't really waste a lot of time to take my NCLEX. I studied right away. I was working, but I was studying, and then I gave myself a few weeks to study and take the NCLEX, and I passed by God's grace. When I finished that, I started work immediately. I was already working at this facility, so I just transitioned into the role of a nurse. And once I got in, I had my orientation. It was not the easiest, right? I'm going to make a video where I actually talk about my first year experience as a new grad being a float pool nurse. You don't hear that quite often, do you? So it's a lot of stories to tell about that one, and I promise you guys that it's coming soon. So just stick to the channel, subscribe, like if you haven't yet. Whatever forum you're watching this video on, do well to follow us for more content. So that's a little short story of how I became a nurse. If you have any video ideas or any topics you want me to cover, put it down in the comment section. I'd like to hear your feedback as well. You're more than welcome to ask questions, and see you in the comment section. Thank you.